We would like to begin today by acknowledging the land that the Atkinson Center is on. As we are all joining from different parts of the world today, I encourage you to take this time to reflect on what the land means to you. We acknowledge that Toronto is situated on the traditional territory of many Indigenous nations, including the Anishinaabe, the Haudenosaunee, and the Wendat peoples. Today, this land remains home to diverse First Nations, Inuit, and Métis communities. We also recognize that Toronto is covered by Treaty 13 of the Mississaugas of the Credit. As we gather here, we express gratitude and respect for the Indigenous peoples who have cared for this land for generations and commit to meaningful reconciliation and partnership. We hope to have some time at the end of the presentation for a few questions. Please put your questions in the chat. They will only be visible by the webinar hosts. I would now like to welcome Gordon Cleveland today to our Atkinson webinar series. He is a respected economist known for his expertise in early childhood education and public policy. Gordon is an Associate Professor Emeritus at the University of Toronto and has conducted extensive research on childcare affordability, accessibility, and quality, influencing policy decisions at both provincial and national levels. His work has been instrumental in shaping Canada's approach to universal childcare, emphasizing its economic and social benefits. Gordon continues to be a leading voice in advocating for evidence-based policies that support families and promote equitable access to early learning opportunities. Thank you so much for joining us today, Gordon.
Thank you. Thank you so much, Amis. So nice to see so many people out. It's fantastic. And I hope the internet works fine. I am joining you from Melbourne, Australia. So if you see the light behind me, it's because it's light out here. It's morning. I hope the internet works fine. But thank you very much, Amis, and congratulations. Amis has just become the executive director of the Atkinson Center, and so congratulations on that. And I'm very happy to be here talking about Ontario's funding formula, although Amis's description of me might make you think that I'm responsible for everything in the childcare environment right now, which unfortunately that's not quite true. Anyway. Let us get going in talking about the funding formula. Okay, so let's set a bit of context here. There's nearly 300,000 children in licensed childcare in Ontario, and that's the 0 to 5-year-olds. And then there's another 200,000 0 to 5-year-olds who are in full-day kindergarten, not in licensed childcare. Some are in licensed childcare, but I already included those in the 300,000, and another 200,000 are in full-day kindergarten, and then another 100,000, a little bit more than that, of children with parents on maternity and parental leave. You add those all up together, that's 65% of Ontario's children 0 to 5 who are currently using different parts of Ontario's early learning and childcare system. And I think that perspective is a useful one. We're doing pretty well in some sense in making early learning and childcare at its different parts universal. So virtually every child benefits from the system at some point as they grow up. And in that sense, we've made huge progress so far in transforming towards $10 a day childcare, but much remains. I guess if you wanted to think about the funding formula, it's very new. It's a newborn, really. And we wish it would sleep through the night, but it's pretty colicky baby right now. And so we're having difficulties, and many operators are having difficulties in staying up through the night, having to look after this colicky baby. But you know, as babies change, hopefully our experience with the funding formula will also calm down, and we will, you know, we'll work out the kinks. Okay. So what does the funding formula do? Well, it determines the amount of revenue that different childcare centers and agencies are going to receive for the provision of services. That's basically what a funding formula does. It replaces parental fee revenue. And it's a cost-based funding formula, not actual costs, but projected or expected costs according to the formula. And it's got financial accountability. So that's fundamentally what we're talking about here. And quoting from the ministry, it's supposedly, they didn't use the word supposedly, but it's based on the typical costs of providing quality childcare in a geographic region based on planned operating spaces. So planned operating spaces runs the funding formula to a large extent. And they say the typical costs and quality childcare, we'll have to look more closely at those claims. The formula determines the center's revenues based on key cost drivers. And so planned operating spaces by age category is a key set of those cost drivers, but there's others as well. But you should also notice this, and this is in the ministry documentation about the goals of the funding formula. One of the goals with the funding formula is to gradually shift the overall cost of providing childcare towards more standardized costs as represented by the benchmark allocations. And what that means is that the ministry believes that the benchmark allocations represent the future for costs of childcare. So that's really important. When you're talking about growing the system, you're going to have to depend on being able to produce good quality childcare within the amount of the benchmark allocations. And right now, that's a very difficult thing to do. So I'll go through this quickly. Many of you know the details. Some of you from outside of Ontario don't know all of the details, but there's basically four main components to the funding formula. A program staffing component, which related to the wages and benefits of the program staff. A supervisor component related to the wages and benefits of the supervisor. And I put supervisor rather than supervisors because the funding formula insists that you only need one supervisor in a center. Even a very large center only gets one supervisor, and that's a problem. Third element, the accommodation component, including the regular lease and mortgage costs, but also maintenance, repairs, insurance, property tax, and those kinds of things. And the operations component, which is related to all other regular expenditures, food, admin, supplies, support staff. And the sum of all of those components above makes up the unadjusted benchmark allocation. So now you take that unadjusted benchmark allocation, and it's going to be adjusted up or down by the geographic adjustment factor. So if I had a center anywhere in the province and it was the same size, so let's say 49 kids in the center, 10 infants, 15 toddlers, 24 preschoolers, that center would come up with the same unadjusted benchmark allocation if it's the same number of days of opening per year. But basically, it's going to come up with the same unadjusted benchmark allocation, no matter where it is in the province. But then you have to put on the geographic adjustment factor, which takes in cost variations across the province. And the geographic adjustment factor can be a number from 0.79 to 1.07. And what that means is, if you happen to live in Kingston, where my daughter lives, you're going to multiply your unadjusted benchmark allocation by 0.79, which means you're going to reduce the amount of money you're going to get in revenue by a considerable amount. If you're in Toronto, you're going to multiply it by 1.07, so you're going to get 7% more than the unadjusted benchmark allocation. So that's a factor that adjusts this calculation of revenue according to geographic related factors. And in italics here, some interesting thoughts about that adjustment. These benchmark allocations are designed so that about 50% of existing licensees are going to have their expected eligible costs fully covered, only 50%. And the other 50% will not have their costs covered by the regular benchmark funding allocation. So that would mean, if they did nothing else, that 50% of the centers would be failing financially. So there's a legacy top up. I'll talk about that in a second, but legacy centers with higher costs will be eligible for a legacy top up. So point six here is the legacy top up for existing spaces, or if you're not an existing space, if you're talking about new spaces, you get a growth multiplier. The legacy top up basically tries to cover for those centers that have higher costs than the benchmark. Doesn't want them to go out of business, so we're going to give them a top up to cover essentially their previous costs based on their circumstances in 2023 for the most part. So we're going to give them a legacy top up. But for new spaces, you're going to take that benchmark allocation and multiply by a growth multiplier. More on that in a minute. And then there's a calculation of profit or surplus. A guaranteed markup in the Ontario funding formula of about 7 or 8% of revenue. And I'll say the 7 for 8% of revenue. Most people don't look at this very carefully, but profit can be stated as a percent of capital invested or a percent of revenue. So the Ontario funding formula gives you a quite high percent in 7 or 8% of revenue. That's quite a high number. If you expressed it as a percent of capital invested, it's probably a very healthy profit rate. It is in general, depending upon the amount of capital invested. Okay, too many details here. Cost drivers. So these are the key factors that influence the expected costs, and the ministry has estimated benchmarks to reflect the effect of these different cost drivers. So for example, in that, I said there were 4 main components at the beginning, one of them being the program staff component. The key cost drivers in there, or 2 of the key cost drivers, are the number of licensed spaces in each age group and the number of days the child care is provided per year by that center. And so, for instance, here's the benchmarks that the province of Ontario puts forward for the program staffing component based on the number of spaces. So for each day in that your infant space is operating, $92.03 goes in your revenue, your calculation of total revenue. And for a toddler space, $56.48, and going down $39.23 for preschool space, only $15.03 for a kindergarten space. And so one of the questions here is whether there really is enough money for kindergarten spaces. I feel like I'm back teaching an economics class here, so some of you may fall off the wagon at this point. What this diagram is showing, and this is actually a diagram that comes from the ministry in the recent technical document, it tries to express how did we come up with these benchmark allocations? What is a benchmark allocation? When I say it's $92.03 for an infant space, what does that mean? How did we get that? And the answer is they got it by collecting data on costs across the province and then drew a line through all of the cost data, and the slope of that line is the benchmark. And so here I've got it, it's a made-up example. It's not a real example, but what you have here is a whole lot of little points, those sort of brown-gray dots there, that represent individual centers. And those centers have a high cost or a low cost. And if they've got a high cost, they're farther to the north. And if they've got a low cost, they're farther to the south on the diagram. And that's related to the cost driver, which is measured in the other direction, right to left. And that's in this diagram, it's the number of spaces in the center. And so each point represents where your particular center has in terms of its total costs, but also its size. And then, so that's a whole lot of cost data that's represented by all those little dots. And then a regression line draws through and tries to get what's approximately the way in which cost and size of center are related. And that regression line tells you what the average relationship is in between cost and size. But what I'd like you to see about that is all those dots that are on the top, that are above that red line you see on the diagram. Those are centers in Ontario, who have higher costs than the benchmark. So they have, for the size of the center, they have costs that are a little higher than the other centers. Well, part of the difficulty here is that a lot of those centers with the high costs are also the high quality centers. And so by drawing a benchmark that runs through the middle of that set of points the way we do, we're leaving out the higher quality centers. We're not giving them enough revenue with this benchmark in order to cover their costs. And that's going to be a problem for growth going forward. Okay, if you happen to want to see all these different benchmarks, you can find them in the ministry documentation. Here's a whole bunch of them, for different parts of it, the program staffing, the supervisor, the operations, and the accommodations parts of it. These are all the different benchmarks from which the funding formula is calculated. Okay, so that's a lot of details on the structure of the funding formula. What does it amount to? Well, here's some calculations that I've done. And these are calculations about how much money you will get for a new center, the new spaces, and it's got to be a 49 space center, so 10 infants, 15 toddlers, 24 preschool children in different parts of the province. So over on the left hand, this column says 1.59, that means 1.59 million. So the operating funding, not the profit or surplus, leave that to the side, but the operating funding that you have to pay all your regular costs with, you're going to get in Toronto for that center would be 1.59 million. So quite a fair amount of revenue provided by government for the operation of this center. Now, not all of that revenue comes from government, because this includes both the amount that you would get from the parent fee and the amount that you would get from government. So that's how much money you're going to have to operate the center, 1.59 million in the city of Toronto. But look at some of the other columns. There in Ottawa, you get 1.4 million. Windsor and Kingston, you get 1.18 million for that same 49 space center. And Lennox and Addington, don't know whether we've got anybody from Lennox and Addington here today, but you only get just a little over $1 million. So that means that the center in Toronto is getting 50% more for its operations than that center in Lennox and Addington. Or even if I want to compare Windsor and Kingston to Toronto, there's 35% more revenue in Toronto than in Windsor and Kingston. Now, is that a reasonable geographic adjustment factor? It seems to me that that's a very large difference. Here's a way of thinking about it. Our workforce strategy in Ontario now has the wage floor for early childhood educators with a 2-year diploma, RECEs. They get $24.86 an hour. Okay, that's the wage floor, $24.86 an hour. Other provinces get more. Some other provinces are more generous than that, but we're not yet very generous in Ontario. $24.86 an hour. So if the center in Windsor and Kingston were paying $24.86 an hour, what would the equivalent wage be in Toronto if I'm going to reflect this 35% difference? Well, the answer is the wage in Toronto would be over $33 an hour. Well, I don't think the costs are that much higher in Toronto. I don't think the wages are that much higher in Toronto. Maybe they should be, but they aren't. So big issues over whether the geographic adjustment factor is the right amount or not. Here's the same calculation, but I'm going to move through it quickly, based for an 88 space center. And now in Toronto, you get $2.61 million of revenue operating funding to run the center, and still very different amounts in different parts of the province. I wanted to look at the issue of how much extra revenue you are going to get as a center according to this funding formula based on, and this is for new spaces, so growth spaces. So you're planning a new center and you're thinking about, do I want infants, toddlers, what combination of those do I want? And so how much extra revenue am I typically going to get if I open up a new infant space? And how much extra revenue will I get from this formula if I open up a new toddler space and a preschool space or a kindergarten space? And these are the answers I've come up with. I took actually 1,750 different possible combinations of spaces and ages of children and all that kind of stuff, and ran some regressions on them, and after calculating what the funding formula would give each one of those centers. And so what we see here is that there's differences according to whether you are opening up this new growth in Toronto and in whether it's a community or a school-based center, or whether it's in some other part of the province. And I've chosen Kingston, and whether it's community or school-based. Now, you could do this for every other part of the province as well, but I've only chosen those two. But really what you see here is the amount of extra revenue you're going to get for opening up an infant space is very large. Of course, your costs will also be a lot higher opening up an infant space. It's not cheap, and the ratios are quite high. 3 to 10 in Ontario, 3 new staff members for each 10 infants. So costs are going to rise a lot, but your revenues are going to rise a lot. So over $140 of additional revenue is associated with the opening up of a new infant space, close to $100 for a toddler space, close to $75 for a preschool space, but only $38 for a new kindergarten space. All of that in Toronto in community-based centers. And you can see the rest of them, but again, one of the patterns that you're seeing, well, there's two of them really. There's a difference in between community-based and school-based centers in terms of the revenue pattern. But also there's big differences across the province according to where the location of those new spaces is. And we care about that because we want to know whether this funding formula supports growth. And I think there's a hint here that suggests that growth is going to be difficult in some parts of the province where the growth adjustment factor has reduced the amount of extra revenue that you get out of the funding formula relative to the better compensated parts of the province. Home childcare, excuse me. Again, these are details, and we don't want to go deep into the details, but the provider compensation for home childcare is based on the number of active home days. So it's $155 per active home day, a day of care in an active home. But it's independent of the number of children. And that seems very odd. And in fact, all of the elements of compensation, whether it's for the provider, whether the home visitor, or whether for the agency, are based on the number of days of service, but not on the number of children. So it's on the number of days that those are open. So the total amounts are not enough, and the compensation should be based on the number of children cared for and the hours of care. And here's those benchmarks as they apply to home child care. So let's try and bring this all together in a few slides here. We are building a new publicly funded, publicly managed childcare system, and a supply-side funding formula, like Ontario's funding formula, is part of providing universally affordable and accessible childcare, $10 a day, which is what we want to do. And Ontario has made a good stab at trying to come up with a cost-based funding formula, which is more than I can say in the case of, for instance, Alberta, which has come up with a really a fee-based rather than a cost-based funding formula as their first attempt at it. But there are problems with both the process of implementing the new funding formula and the formula itself. The process has been rushed, new systems have been developed on the fly, the rules of the game are unfamiliar to all the people in the system, and operators and SSMs, service system managers, will make mistakes and have made mistakes. There's been mistakes on the amount of money that's gone out to operators, and then it has to be clawed back, and that creates chaos and difficulty. So we're in that period in which it's difficult to adjust to the funding formula, particularly since it's been rolled out, decided on, and implemented so quickly. The funding formula does protect existing centers through legacy funding, because otherwise the benchmarks would not be sufficient to support quite a few centers. But the funding formula is not really yet sufficient to support growth and the necessary staff compensation that we want. We all know that staff compensation is still low in Ontario, and needs to rise considerably over time. Even the ministry knows that is going to need to happen, but it's happening too slowly. And it's a backward-looking funding formula based on what the costs were. So those differences that we talked about in between, let's say, Kingston and Toronto, they came out of the analysis of costs that the ministry did. But you'd have to ask, why were the costs in the old days particularly low in Kingston? And probably it was because the wages were low, because it was a system all based on parent fees. And so old costs don't necessarily reflect what we want to do going forward. And we do need a forward-looking funding formula that designs its compensation, its revenues, based on what kind of compensation will incentivize the things that we want in the system. So in particular, incentivizing and supporting quality services across the province. So there are a lot of positives. The new funding formula is much better than the continuation of the revenue replacement model that we had for the first 2 years in Ontario, the finger in the dike funding model that we had for 2 years. And this is a new and better replacement. And in theory, future revenues can now be known with certainty. You can do the calculations, as I've done them, on the funding formula and know how much revenue you will get in the future and how much revenue you will get for new spaces. So decisions about expansion in theory can be made. In practice, of course, there is still uncertainty. It's a whole new system, and there are uncertainties that still remain. Legacy cost allocations mean that existing centers with costs higher than benchmark costs can continue to operate. That's very important. And when the benchmark's above what your costs have historically been, you are now going to get extra money from the funding formula to spend. So centers that did have particularly low costs, maybe paid those particularly low wages, will now have extra money to spend according to the funding formula. So perhaps we can get a raising of the quality and the compensation in centers that had historically low costs. Nonprofits will have revenues to build up a surplus fund, so that profit or surplus amount that's guaranteed in the formula. The profit amount is capped, sort of. We could talk about that. There are measures of financial accountability. The municipalities in Ontario have a big role, and they have to implement financial accountability measures throughout the year and at the end of the year, and those will be important. And centers have flexibility to spend their total program cost allocation across categories. So even though I described it as there's the program staffing component, and there's the accommodation component, and there's the operations component, and there's the supervisor component, you don't have to spend the money that way. You get the whole bundle of money, the whole envelope, and you can spend it as you need across the different categories, and that flexibility is a very good thing. Okay. Negatives. The home child care issue, it doesn't take into account the number of children or hours of service. Center childcare, the formula doesn't take into account the hours of service per day, which is a little strange. And it means that if you have a lower number of hours of service per day, you're going to get the same amount of money as a center that has long service hours per day. And particularly for centers that do overnight care, that makes no sense at all. So that needs to be changed. There's no wage grid underlying the formula. We need a wage grid. We don't want to encourage competition in between centers over wage levels and reduced quality. That's not a desirable thing. So we need wages that are higher, and we need wages that are more uniform across the province according to a wage grid. The funding formula doesn't incentivize quality. PEI has a funding formula that does incentivize quality. Ontario didn't decide to go that route, and so ours at this stage does not incentivize the production of better quality services. And it doesn't recognize the deficits and debts incurred in the last 2 years. So since the pandemic, things have been fairly rough for a fair number of centers, and some of them have built up important deficits and debts. And how do they get paid off? There's no recognition of it in the funding formula of existing deficits and debts, and no clear answer to how those are going to get worked off over time. There's not enough money in the funding formula for kindergarten children. The total dollar amount for kindergarten children is low, and particularly right now, this is a big problem. Kindergarten children who happen to be in school-age classrooms aren't covered. So we know that the Canada-wide Early Learning and Childcare Agreement only covers children that are 0 to 5 years of age. It used to be the case that if you were a kindergarten child, you might graduate into a school-age classroom. We're talking about a center that has both kindergarten classrooms and school-age classrooms for childcare. In the old days, you might graduate to the school-age classroom before you turned 6. But now that's a big problem, because if you're in a school-age classroom, but you're younger than 6, so you're a kindergarten child still, you're not going to get any revenue coming out of this formula. Those children are not covered by this formula, and that's an anomaly. We need to find a solution to that, and we probably can, but right now it's causing a lot of stress and a lot of loss of revenue for some centers, and different centers are handling this differently, and so parents get upset about being treated differently by different centers. And still, in my negatives here, we still don't have an answer to the question of where does the capital money come from for growth. We have a little bit of startup money in Ontario, but not major capital money, and that needs to happen if we're going to solve the growth problem we need to solve. Continuing on negatives, there are substantial guaranteed profits, and those are going to attract more for-profit operators and real estate entrepreneurs. And there are a fair number of people gathering around thinking about trying to make money by buying into childcare real estate. Some of that may be good, but much of it is an attempt to make a quick and big buck. There are no provisions to ensure that assets purchased with public funds stay in public or nonprofit hands. That's not part of the funding formula, but we should deal with that problem. And, as I said before, the funding formula is not going to cover the high costs in new centers, such as municipal centers, unionized centers, centers with high wages and benefits. So those will not be covered, their costs for new spaces going forward. And these geographic adjustment factors and growth multipliers play a huge role in how much revenue your center is going to get, but they're not clearly based on true variations in forward-looking costs. A couple of other problems which are important for some single-site centers: bookkeeping and administration are now getting too complicated for them to handle, and that's especially true in centers that provide both the 0 to 5 year old spaces, but also school-age spaces, because the funding system is now completely different for those two sets of children within the same center. And so some cooperation between centers, some development of ways of taking the administrative and financial burden and purchasing services or cooperating to get those services across centers. That may be a desirable thing, or consolidation in some cases of single site centers may be necessary to deal with the intense bookkeeping and administration problems that some are experiencing. And the formula as it exists now doesn't work well for multi-site childcare operators. It's based on individual childcare centers. So if you've got 30 childcare centers in your multi-site operation, each one of them is funded separately, and the tracking of the money occurs separately for each one of those centers. And you don't have an ability to move surplus revenue from one site to another, from one that is in surplus because of this funding formula to one that's in deficit. So that again needs change. Questions, issues, and problems. Will the funds for the new centers support true costs at decent wages and quality level? Well, it's uncertain, and it does depend. It depends a lot on what part of the province you're in. It depends upon what level of wages you're talking about and what level of quality you're talking about it. But without being able to answer this question with a really strong positive yes, nonprofit growth will be halted or held back. And governments need to provide supports for expansion, not just through the funding formula, but in terms of capital expansion and supports for the process of construction and building and going through all the difficult approvals that are necessary for growth to happen. Big problem, the ministry thinks the funding formula is fair because they believe the survey data they collected on costs reflected true variations, but there's not as much variation in underlying costs as the ministry thinks there is. And so they've developed geographic adjustment factors, which are too large, make too much difference in between different geographies. But the funding formula does show what we've always said: profit takes resources away from children's care. I mean, what's going to happen is that for-profits are going to take that 7 to 8%, and the money will go into owners' profits. Non-profits and the public operators will take that surplus and use it to improve wages, working conditions, and the quality of care. And then over time, that's going to mean quality will diverge even more in between these two auspices. So that's what we can expect, I think. There are bad behaviors encouraged by the design of the funding formula, and I hope we get a chance over the next year or so to really revise some of these in the funding formula. If you reduce hours that your center is open, you're going to get the same amount of money, but your costs will have fallen. If you take lots of children part-time, you're going to keep the same amount of money, but your costs will have fallen. Those don't make sense, but they're encouraged by the funding formula. And you're encouraged to not serve children who require more intensive staffing and to avoid taking children with special needs. Again, very undesirable feature, which is encouraged by the design of the funding formula. Can be corrected, but so far has not yet been corrected. It encourages keeping wages as low as possible, and this is really the absence of a wage grid across the province. Avoid hiring pedagogical assistants and reduce professional development. These are ways of saving money, but they may, harm quality. Charge parent fees for services and products outside basic childcare. This is a huge problem in Alberta. So far, that's been very modest in Ontario and to a fair extent made illegal or not permitted. But that will be an issue that we're going to have to deal with going forward. And again, in terms of what's encouraged by the funding formula, if you wanted to open up new spaces, you're going to look for those areas of the province that have the high growth multipliers, not the low growth multipliers. Poor Cornwall has a growth multiplier of 0. So they don't get any extra assistance with new growth. And the numbers vary from an extra 30% down to 0 in terms of the growth multipliers. So people are going to shop around for where the high growth multipliers are, where the high geographic adjustment factors are. So that, there'll be too much encouragement to develop in some places and not in others. Centers will be encouraged to establish separate centers for school-age children by the funding formula, and that's really a lot because only one supervisor is funded. So if you have a large center, you might well split it along school-age children versus 0 to 5-year-old children. Might simplify the bookkeeping, and now you're going to have a full supervisor funded for your 0 to 5-year-old children by the funding formula. You'll be perhaps encouraged to hire less experienced staff, get director approvals, and perhaps encouraged to lease your own premises to yourself, or increase your mortgage payments and increase the pay given to the owner. Okay, so conclusions. Sometimes I sound very negative. Let me try and sound positive. The cost-based funding formula is much, much better than the revenue replacement model. Thank you, Ontario, for developing a cost-based funding formula. It's a really important step forward. It's not generous enough for kindergarten children. It's not generous enough for home childcare. Those are two things that probably need to be fixed pretty quickly. It's unclear whether the revenues are enough to support growth, and the geographic variations appear to be too large, and that's going to really harm growth in certain parts of the province. And as of with the last slide, various bad behaviors are encouraged by the design of the funding formula, and some of those things need to be fixed relatively quickly. The ministry has said, and this is very good, that the funding formula is supposed to change each year as necessary. And that's certainly true about what's happened in Quebec. They've had a funding formula for many years for the CPEs in Quebec, and their funding formula has been updated and changed and amended each year. And that's a necessary process, so let's look forward to that. And in order to have that happen, nonprofit childcare providers and all of us need to do our homework about all of the problems and issues in the funding formula and advocate for improvements. Thank you.
Thank you so much, Gordon, for that very informative presentation. And I'm sure a lot of questions are noodling around everyone's mind. We have some time for questions, so you can put them in the chat. I already have a few that, Gordon, if you would be so kind. You did speak a little bit about this in the bad behavior encouraged by the funding formula section, but how does the formula ensure that families with diverse needs, such as those with children with disabilities, receive appropriate support? Can you speak a little bit more about that? Seeing it in the bad behaviors is already telling us that they're not addressed in the way they need to be.
Yeah, I don't know whether the ministry has come up with anything recent, but it hadn't covered that in the last couple of months, and I haven't seen anything since that deals with children with special needs. It was not part of the funding formula. There's no element of the funding formula that speaks to care for children with special needs. You don't get an extra pot of revenue because you're caring for children with special needs. It used to be the case under the old system that the municipalities were required to spend, was it 4.1%? I think it was, on children with special needs. Like there was a requirement that each of the municipalities in their allocations spent a certain amount on children with special needs, as you know, as a way of mandating that. And so far as I know, that has not yet come out. It's not part of the funding formula. It would be separate, and I haven't heard anything. Maybe somebody else in the audience will have heard something.
I think, and then we know in reality, many regions are reporting much higher percentages of their funding allocated to children with disabilities. Another question is, could you explain more why a wage grid is so critical and how bad it is that Ontario doesn't have one yet?
Yeah, I mean, there's two issues. There's the height of the wages, and then there's a wage grid. And you can think about those somewhat separately. The height of the wages, but of course they're very strongly linked, but really the height of wages, the level of wages that we get in Ontario, what 24.86 an hour as of January the 1st is the new floor for RECE wages in Ontario. But I mean, the average wage in the province is what, $36, $37 an hour. So you're a very low paid worker if you're earning $24.86 an hour. And yet we're in a situation where we have to recruit a lot of well-trained new educators. And we have to do that to keep the existing system running. And we have to do that in order to grow. And the amount of growth we need is very large. There's, according to the StatsCan study recently, there's 150,000 children on waiting lists in the province of Ontario right now. So not only do we have to deal with the 300,000 that are currently in childcare, but we need at least another 150,000 who are on waiting lists. We need to serve them. We need a lot of additional staff. So staff wages need to be considerably higher than they are. They need to be an awful lot closer to the average wage in the province if we're going to attract who we need to attract and the numbers we need to attract. So that's the general thing, which talks about why it's important to talk about wages at all. And then a wage grid, what it does is it establishes a certain amount of fairness across from one center to another. You don't want really centers, not paying for experience. You want to encourage workers, staff, educators to stay in the sector for a long period of time. So you need to be able to reward experience, and you want to do that somewhat uniformly across different centers that they might work in. And you don't want centers sort of competing to steal workers from one center to another. So a wage grid allows you to both raise the level of wages, which is important, but also to establish fairness in terms of how each worker is treated.
Thank you, Gordon. There's a few questions around the local priorities funding, whether around funding that municipalities have been provided to support children with disabilities and special needs. Can you speak a little bit to that? Has that been something that you are looking at?
Yeah, I don't know much about local priorities funding. I bet you there are people on the call that would be able to. I don't know whether your technology allows you to have somebody else speak, but somebody else would know more about local priorities funding. So what we're talking about is money that goes to the municipality to deal with local priorities, which is, I guess, where special needs children are sitting at the moment. But I haven't really followed what's happening with local priorities funding.
Another question, you spoke quite a lot about geographical adjustments by region. Is there any mechanism in place to prevent funding disparities even within regions that are urban versus rural?
Yeah, the regions are defined. Okay, so what you have is you have the geographic adjustment factors group different municipalities together, but there's like what we're talking about in Ontario is we've got 47 different municipalities, service system managers, who are the fundamental agents that run the system, manage the system at the local level. And uh, I mean, it's true that in any SSM, there will be rural and urban parts of it. There may well be differences in costs across those two. Those two, whether urban or rural, will get the same allocation, both the same geographic adjustment factor, but also in general the same growth multiplier. So if it were true that costs are lower in one part, maybe that'll give you an incentive. Often it's the case, though, that where the costs are low, also there's fewer people there to demand the service, and might be harder to set up a new center in that area because the demand is somewhat thin. So I'm not sure that's a huge problem, the differences in between urban and rural across a service system manager. And it is something that the service system managers will probably be able to respond to because they do have some funds and can usually allocate them to deal with disparities within the SSM.
Thank you. How will the funding allocation be monitored to ensure that providers are using it effectively and responsibly? Is there a monitoring mechanism?
It depends on what you're talking about here, but I mean, part of the difficulty, I mean, yes, there's financial accountability monitoring, that's on the one hand, but I'm worried about another kind of monitoring. So um, there are a few things in the funding formula that people may not be completely aware of, but can really bite them. And I'm not sure that the monitoring is there to tell operators that these things are there and important. So let me give you an example. If at the end of the year you have been given an allocation, a benchmark allocation according to this funding formula of a certain amount, and you don't spend it, that amount is going to be clawed back from you. If you had a legacy top up, so that means that you had particularly high costs compared to the benchmark in the old days, and you've been given a legacy top up to give you revenues comparable to what your previous revenues were. So you get that. Say that's all successful, but at the end of the year, you didn't spend all of the money you were given. So you were able to keep your costs down below what they'd historically been for some reason or other. Maybe just because you're worried about the new funding formula. You're worried about running out of money. So you're watching your expenditures really carefully. And so at the end of the year, you haven't spent all of the legacy money that you were given. It can now be clawed back from you, and your legacy amount in the future will diminish. So you will not keep the same amount of legacy allocation because you didn't spend it in this year. So what that means is that there's a couple of ways in which operators may be unclear about what the new rules of the game are. And the new rules of the game are you have to be quite careful about managing your spending and making sure that you don't arbitrarily keep it too low, because in fact you can lose money the way the funding formula works in future years because you didn't spend enough this year. So don't be afraid to spend. I mean, I'm not saying overspend. I'm just saying don't be so cautious that you underspend, because in fact you can end up losing money as a result of that. So I'm not sure there is the monitoring to help people completely understand the new rules of the funding formula. And I know different municipalities are trying to do that with different levels of success.
And last question, do you have any thoughts on how we might advocate to prevent those bad behaviors that you listed?
I mean, it starts with, being clear about what their bad behaviors are and putting into the ministry on what the changes are needed in the funding formula going forward. Particularly this one about the hours of service, it will be a real problem, but there are many of them. So, centers have the incentive to drop from 11 hours a day down to 10 or 9. And if their parents will allow them to get away with it, their costs will be lower, but their revenues won't have been affected by the funding formula. This makes no sense whatsoever, but that incentive is in there. So we do need to make I know that everybody's completely absorbed with dealing with their own problems with the funding formula right now. So advocacy broader than that is not top of mind right now. But we do need to be able to put together the list of things that are problematic about the funding formula and begin advocacy on it. I think there will be some appetite in the ministry to say, yeah, we didn't get it perfectly right the first time. That at least is a start. But yeah, advocacy will be necessary for sure.
Okay, well, thank you so much. We would like to extend a heartfelt thank you to you, Gordon, for generously taking out the time from your schedule all the way from the other side of the world to walk us through the details of the new funding formula. Your effort and expertise in guiding us through this complex topic is truly appreciated, and we're grateful for the opportunity to learn from your insights. Thank you, everyone, for joining today, and hopefully the storm won't affect you too badly. Thank you, everyone.